Hello and welcome to my presentation. My name is Jay Wilkins. I'm a naturopath. I've been in the health and wellness field since 1993. I've had a naturopathic practice where we practice homeopathy and herbology, as well as various types of screenings that we did, non-invasive screenings, massage therapy and such, from about 1993 to 2005. And it's in 2005 when things really changed for me. That's when I first learned about nitric oxide, which you're going to hear a lot about in my presentation. From then, I became a trainer in pulse wave analysis, and we'll talk about that towards the end of the presentation, and very much into nitric oxide nutraceuticals. I was on the medical advisory board for a company that was their flagship product, a nitric oxide product. I then developed two other products for a couple of other companies that were nitric oxide precursor based. And then in around 2012, I got involved in good manufacturing, policy compliant manufacturing, became a medical advisory board for a manufacturing company, manufacturing of supplements. And to this day, I still do consulting to help customers put their formulas together when they need help. And then in 2013 is when we launched Bionox. And Bionox means life, bio. Nox is a play on nitric oxide. So our supplements always revolve around nitric oxide with maybe some spillover into the cardiovascular realm, which you'll see the importance of nitric oxide as far as its cardiovascular benefits. And so 2000 to present, I've really become a nitric oxide enthusiast. And I very much hope by the end of this presentation that you will be more enthusiastic about nitric oxide as well. So the name of the presentation is What Everyone Should Know About Arginine, Nitrates, and Heavy Metals. And of course, all of these things as they relate to the miracle molecule, nitric oxide. As we can see here, it's a very simple molecule. It's just one part nitrogen, one part oxygen. It's a gas that your body makes throughout the body. It's ubiquitous. It's made through your cardiovascular system. It's made in your digestive system. It's also made on your nerves. And again, throughout the body, your cells make it. There's some 140,000 plus research articles to date. It really started to gain momentum in its understanding in 1992 when it was named Molecule of the Year, and since then has become the most researched molecule in history. Understanding this molecule has led to the formulation of many pharmaceuticals, including a little blue pill that was supposed to have been good for helping with blood pressure. It didn't work that great for blood pressure, but the men in the studies said, well, it does work in one certain area to increase circulation, and it led to this whole new class of drugs by Pfizer, Viagra, of erectile dysfunction drugs. But again, it has its foundation in nitric oxide. Now, when things really came to a head and this understanding and interest in nitric oxide was when three American scientists won the Nobel Prize in Medicine for their discovery of the nitric oxide pathway. So here's a picture to the right of these three scientists here, these three medical practitioners. And as it says here in the Associated Press, they won this for their discoveries concerning nitric oxide as a signaling molecule in the cardiovascular system. So nitric oxide is very important when it comes to your cardiovascular system. Why is this good news? Well, heart disease is the #1 cause of death. Some 600,000 die each year due to heart disease. As women going through their menopausal years, 50 and so, there's 50% men, 50% women that die of heart disease. 60% of youth are at risk for heart disease. 70% of 12-year-olds already have fatty streaks developing in their arteries. Every 60 seconds, someone dies of a heart attack. It's like 7 fully loaded 747s crashing every day. And so we see the implications and the challenge as far as cardiovascular disease. Here's the question, what does it do? Well, really the question is, what doesn't it do? I have a white paper that you can download off of our website that shows 118 different studies. Again, just a sample of those 140,000 that are out there. But you can see anything related to cardiovascular issues, from plaquing to blood pressure, cholesterol, triglycerides, you name the cardiovascular issue, nitric oxide has been shown to be able to help those issues. But it's not just for cardiovascular. As mentioned, it's called the miracle molecule because it does so many good things in your body. It helps with high blood pressure, which is also in the cardiovascular field, but also with things related to sleep, things related to athletic performance before, during, and after a workout. It has benefits for lung health, like asthma. We see the importance of it with regards to blood sugar issues, especially the complications of diabetes and such. And we're going to talk about a gentleman, a doctor that has had great success in his practice as a diabetic specialist. We see a bone health. We see a urinary tract, kidney, bladder, prostate. And we also notice the importance of this for cognitive issues. So brain function, as far as it relates to depression and those type of things, but memory as well. And there's just a whole gamut of things that L-arginine, being a precursor of nitric oxide, what it can do. So this is Dr. Jonathan Stamler when he was at Duke University. He studies the effects of nitric oxide. That's his main field of study. And his quote is, "It does everything everywhere. You cannot name major cellular response or physiological effect in which nitric oxide is not implicated today. It's involved in complex behavioral changes in the airway relaxation, beating of the heart, dilation of blood vessels, regulation of intestinal movement, function of blood cells, the immune system, even the way fingers and arms move." So nitric oxide has also been called the spark of life, because when your father's sperm met your mother's ovum, it got to the ovum there and it let out a burst of nitric oxide, and it was that sperm was able to penetrate the ovum to create you. So you are here thanks to nitric oxide. We've also heard things come up during COVID about nitric oxide. They actually, in emergency situations, can administer straight nitric oxide gas, and it helps for inflammation, for reducing viruses, as well as opening up the lungs and the breathing. So does tremendous things in the body. The cool thing is that your body makes it on its own. And that's what we want to do, is to try to help the body to create a nitric oxide on its own. Now, there's some books here that I'm going to show that had a huge relevance in my career. The first one, The Cardiovascular Cure by Dr. John Cook, the head of cardiovascular research at Stanford. And the cardiovascular cure, of course, is nitric oxide. We have the book No More Heart Disease, NO, nitric oxide, No More Heart Disease by Dr. Ignarro, who is one of those Nobel Prize winning doctors from 1998. The Arginine Solution by Drs. Freed and Merrill, an excellent book that discusses the benefits, again, of arginine being that precursor to nitric oxide. Then another book that's recently become a favorite of mine is more about nitrates. And we're going to talk about the difference of arginine to nitrates and how your body creates them, and how the pathways differ a bit. And so the name of Dr. Bryan's book, I've carried these books also on my website, Functional Nitric Oxide Nutrition. Very excellent book. So how does your body make nitric oxide? Well, when you laugh, we've talked about laughing being like good medicine, internal jogging, if you will. It helps to create nitric oxide. Exercise definitely helps to create nitric oxide. Dietary nitrates, like from beets and arugula, spinach, kale, and other green leafy vegetables. There's also infrared and beamer waves that help generate nitric oxide in your body. A small amount of alcohol does this, and we've heard of all the benefits of wine, but again, it's in moderation. If you drink too much, it actually reduces nitric oxide. And then L-arginine. Arginine is a semi-essential amino acid, which means your body makes a certain amount of it, and the rest you must get from your diet. So what's the problem then? Well, the problem is with nitric oxide is that your body slowly begins to decline in its production with age. So age is the biggest factor when it comes to a reduction in nitric oxide. As we can see from the graph on the left, that when you're 20, you have your optimal amounts of nitric oxide. When you hit 40, you have about 50% of the nitric oxide you did when you were 20. So outside of age, things that cause a decline in nitric oxide is genetics, ethnicity, diet, medications, stress, as well as smoking. Now, as it relates to cardiovascular issues, on the right, we see a graph here. And the first slide that shows normal means the endothelium, the inner part of the artery, is healthy. It's able to do its job. It's able to protect itself from cardiovascular issues if you're producing enough nitric oxide. But over time, what happens is you develop these cracks in the inside of the blood vessel, and your body fills in those cracks with small particle lipoproteins, the LDL, the bad cholesterol, but those small ones, they get in there and they create more damage. Eventually, you're making foam cells, you get infection in there, you get heavy metal toxicity, you can get inflammation, glycation, calcification. All this nasty stuff starts brewing underneath the endothelium, to where as we look further down the pathway there, and eventually all that toxicity underneath the endothelium can burst. And when this happens, your body compensates by making a thrombus or a clot. And so if this happens in the neck or the brain, of course, that leads to a stroke. If it happens in the heart, then that leads to, of course, a heart attack. And so the takeaway, though, is that the majority of those 600,000 heart attacks that people die from every year, most of them are caused by this vulnerable or soft plaque, not these calcified plaques that can be picked up through X-ray imaging. So that's the challenge, is that it's hard to know where these silent killer soft plaques lay, but we see the problem. It's a huge issue. So let's go back to the endothelium. The endothelium is just one cell layer thick around all of your arteries. If you were to scoop up all your endothelial cells and put them into an organ, it'd be about the size of your liver. So it's a very important part of your body. As Dr. Van Oot says, you're only as old as your endothelium. And that is certainly true when it comes to nitric oxide production, because we're going to see the correlation between the two here in just a minute. But the word picture that Dr. Cook uses is in his book, The Cardiovascular Cure, is that when your endothelium is healthy, it's like Teflon. Everything just slides through and works well, as opposed to when it becomes dysfunctional, then it becomes more like Velcro, where things stick to it, all those lipoproteins and the inflammation and all these things stick to metals and so on. So we want to get that endothelium nice and healthy. So how does this relate to nitric oxide and the endothelium? Well, as we mentioned, arginine is a semi-essential amino acid. And so as your body makes it, or as you consume it, we see what happens is the arginine is taken in by the endothelium, and then the endothelium creates this enzyme called nitric oxide synthase. And so when you have good, healthy nitric oxide synthase production, then you can convert that arginine into nitric oxide. What is the first thing it does? It relaxes the blood vessel. It's a relaxing factor. And this is very important. In my experience, I've not seen anything like these nitric oxide precursors work as effectively to deal with blood pressure issues than anything else. They're more effective than anything I've seen nutraceutically or pharmaceutically. And I've seen people come to my office that were on 4 medications, still couldn't get their blood pressure down. And using these precursors, you can help with that, help the body to do what it needs to do to then correct itself. Now, you'll notice also citrulline at the top of that cycle. So citrulline converts into arginine, and then that arginine is converted into nitric oxide. So citrulline works very well in conjunction with arginine. It creates almost like a turbocharging effect of arginine, as well as a time release effect. So we'll talk about the benefits of time release too as we go along here. But again, this is Dr. Ignarro, one of those Nobel Prize winning doctors. And this is what he says about arginine. He says, L-arginine is a naturally produced protein building block called an amino acid. L-arginine enhances blood flow, improves the activity of the endothelial cells because it is converted to nitric oxide in the body. So again, we see the correlation between arginine, the endothelium, and nitric oxide. Although L-arginine is found in some foods, all your protein sources, meats and beans, soy, nuts, you cannot normally consume sufficient amounts in your diet from meals alone. So I will be recommending that you take L-arginine supplements each day. Well, I've been following Dr. Ignarro's advice since 2005. I have been consuming arginine and citrulline on a daily basis. Now, this is a really good visual of what arginine, citrulline, as well as antioxidants can do when it comes to plaque regression. So these were studies that were actually done by both Dr. Ignarro and Dr. Cook in separate studies. And we can see what happens in the very extreme left there with group 1. When rabbits were giving a high cholesterol diet, they all developed plaque here in their aorta. And as they were given a regular rabbit diet after that, the plaque stayed, it didn't go away. But when they administered L-arginine, we see nice plaque regression in group 2. Group 3, we see also citrulline helps. Group 4, we see arginine and citrulline together really does a nice job. In group 5, we see what antioxidants do, vitamin C and E, they're helpful. Group 6, arginine plus antioxidants. But group 7, we see the synergistic effect of L-arginine, citrulline, as well as the antioxidants, vitamin C and E. We get the best plaque regression when those are used together. Why is that? Well, arginine and citrulline help to produce the nitric oxide. Vitamin C and E help to sustain the nitric oxide. How? By reducing the free radicals. So nitric oxide is a very short-lived gas, just a few seconds, and it's very susceptible to oxidation. And so by giving antioxidants along with it, you actually help to, again, boost the benefits and the sustainability of the nitric oxide molecule. In Doctors Freed and Merrill's book, The Arginine Solution, we see their quote. It says, in the field of medicine and health, it is one of the revolutions of our time. The discovery that the amino acid arginine may be the magic bullet for the cardiovascular system. Very astute point. Again, that's their words. Now, I've seen very similar. You name the cardiovascular issue, from plaquing to blood pressure to lipid issues to enlarged heart, cardiac function or output, arrhythmias. When it comes to blood pressure, I don't know if I said that or not. I think I probably did. I know we covered that. But regardless, you name the issue, and nitric oxide, improving nitric oxide outcomes have made positive changes in all of these different types of challenges. So now we're going to go through and talk about some of my nitric oxide superheroes, if you will. Many of you may recognize this gentleman, especially if you have any sort of age on you at all. California doctor, was very involved in talking about nutrition. He had a newsletter 30 years ago or better, and he was a medical doctor talking about these things that were, as far as nutrients are concerned, where really no other medical doctor was doing this, at least not to the extent that he was. So this is what he says about nitric oxide and arginine. He says, inadequate production of NO, nitric oxide, increases arterial damage. There is a way, however, to break this vicious cycle. Arginine supplements have been shown to restore normal function in damaged arteries. So we're starting to see you are not stuck with your plaque. There are things that can be done. Dr. Sherry Rogers, medical doctor, wrote the book, The High Blood Pressure Hoax, very outspoken. She's not one that's really into pharmaceuticals. She speaks about them quite a bit, as a matter of fact. But this is what she said about arginine. She says researchers have shown that not only does nitric oxide slow plaque growth and suppress arteriosclerosis from forming, so again, we're talking about prevention, but she says, but arginine has actually melted away plaque that already existed on artery walls. Dr. Stephen Sinatra, he is a integrative cardiologist. So he can do the prescriptions and the surgeries, but he would much rather get things in check prior to this. And so he mentions in his book, L-arginine has value for the whole gamut of atherosclerosis, from early signs such as high blood pressure and erectile dysfunction. Now, this is important. Doctors should be asking their male patients if they have these issues with erectile dysfunction, because it's a sign that they got cardiovascular issues, period, throughout their body. So it's good that they would find out about this. But he goes on to say, to advance cardiac events, we feel it offers promise for plaque stabilization. Remember the slide we showed earlier of the plaque bursting? Well, he's saying that with arginine and nitric oxide, you can help to stabilize that plaquing from bursting. But then, as in bold I have there, and its reversal. It is inexpensive and non-toxic. We use it clinically for treating angina, high blood pressure, erectile dysfunction, and stubborn risk factors we can't otherwise improve. So that's enlightening as well. When they're having challenges with a particular issue with the cardiovascular system, they give more arginine, and they can get the outcomes that they're looking for. Now, this is by far my favorite superhero when it comes to the whole arginine and nitric oxide story. This is Dr. Joe Prendergast. He passed away in his 80s last year. But as we can see, the challenge with diabetics is heart attack and stroke. So I met Dr. Joe right in that 2005 time period. We were on the same medical advisory board for a nutritional company at the time. But it was so great just to hear his stories and the things that he accomplished with his own health, as well as the health of his diabetic patients. So when he was in his 30s, he knew that he had cardiovascular challenges. His dad had had strokes, several of them. So he knew he had a genetic predisposition. So he used to lecture in behalf of the benefits of statin drugs for diabetic patients. And his colleague, Dr. Victor Zhao, who was the head of cardiovascular research at Stanford at the time, who went on to Harvard to oversee all of their medical side of things, he would lecture, Dr. Zhao would lecture on the benefits of statin drugs for cardiovascular risk patients. So when they were lecturing, after one of the times they lectured, Dr. Zhao leans over to Dr. Prendergast and he says, "You're going to love my research because I actually have something I found that's a nutrient that can help to reverse arterial damage." And Dr. Prendergast is like, "Well, I need to know about it because I have my own health issues that I need to deal with." But Dr. Zhao wouldn't tell him because he said, "It's my research," and doctors are famous for stealing each other's research. But he went online and he found out what it was, and it was arginine. Now, this was important to Dr. Prendergast because he knew that for his own issues, that medicine was not the answer, not pharmaceuticals, but rather he knew that it had to be in the field of nutrition. And the reason it caught his attention, because he had asked a colleague of his to do an abdominal aortic scan on him. And after he got the x-rays, his colleague put his x-rays on the light box, and without looking at him, he said, "Who's your cardiologist?" Because he saw the plaquing. And that was in his 30s. So after Dr. Prendergast learned about arginine from Dr. Zhao's research, he started taking it. Now he's in his 60s. He goes back to the same doctor that took his x-rays in his 30s. And this time after the scan, he says, "What are you doing?" And I want to do it, because his arteries were completely clear. So he was healthier as a 60-year-old than he was as a 30-year-old. He had reversed his own plaquing. Now, this is important to him not only personally, but for his practice. Why is that? Because 75% of diabetics die of heart attack or stroke. He was sending 250 patients a year to cardiologists prior to his understanding about nitric oxide and arginine. After he started implementing arginine and giving that to his patients, he had about one per year that he had to send out to a cardiologist. Well, this got the attention of the cardiologist that he was referring to. In fact, there was 3 of them that shared these 250 a year patients. And they took him out to lunch and they wanted to know, well, what is he doing or what the problem is? First, I thought maybe he was mad, but they found out, no, that wasn't the issue, but that he was not needing to send his patients to cardiologists anymore. And the reason was because he was giving them arginine. These 3 doctors could care less. 2 of them actually ended up closing their shop, and one of them moved to Atlanta where they could have more opportunity. And so they didn't want to know that. They didn't go to school to do this cheap little arginine deal. They went to do high dollar surgeries. So just a fabulous doctor, wonderful bedside manner, excellent lecturer, very much missed, and I'm glad I got a chance to get to know him. Now that's the arginine pathway. Now we're going to talk about the nitrate, nitrite, nitric oxide pathway. So it's the same molecule. There's no different in what's produced, but very different in how it's produced. So arginine works through the cardiovascular system. Nitrates and nitrites work through the digestive system. So we can see in their image there to the left, we have a plate of arugula. Arugula is very high in nitrates. And so in corn, more so with the nitrites. But when you consume nitrates from arugula, spinach, beets have become a superfood. And the reason they are is because of their nitrate content, as well as other polyphenols and chemistry that they have. But the real secret for their cardiovascular benefits is nitrates. So when you consume nitrates, it interacts with your saliva. If you have a good oral microbiome, that saliva and those bacteria help to reduce those nitrates into nitrites. You swallow the nitrites, they hit the stomach acid, and then nitric oxide is produced. And then you pick it up in your digestive system. Well, as it goes through your body, you continue to reabsorb some of those nitrates. You excrete some of the nitrates through your kidneys, but those ones that stay in your body, they recirculate up into the saliva glands. And every time you salivate, if you have nitrates in there, the process starts over. You convert them into nitrites and so on, and you really get a benefit for many hours after consuming nitrates. So this is established very well in the book or the program, you might say, the DASH diet, which stands for Dietary Approaches to Stop Hypertension. Through that program, it's like a modified Mediterranean diet, but you can get upwards of 1,500 milligrams of nitrates per day when you follow that program. Someone else I suggest looking at, besides Dr. Brian, who we'll talk about in a minute, is Dr. Michael Greger. And you can go and subscribe to his YouTube channel, which is nutritionfacts.org. And you can look at some of his very brief but impactful videos on the benefits of nitrates. So that's the other way that your body creates nitric oxide. So I mentioned Dr. Brian in his book, The Functional Nitric Oxide Nutrition. Excellent read, talks about all the benefits of nitrates. So on his website, this is a quote from him. It says, most, if not all, chronic diseases, including cardiovascular disease, the #1 killer of men and women worldwide, are characterized and associated with loss of nitric oxide production. Loss of nitric oxide production is the earliest event in the onset of progression of chronic disease. So we see, again, he speaks of nitric oxide not only as it impacts your cardiovascular system, but the onset and progression of all chronic disease. That includes your immune system, your T cells, B cells, natural killer cells. All those function and use nitric oxide to disable invaders. So what would make a good nitric oxide boosting supplement? Well, when it comes to arginine and citrulline, you want to have the right ratios. It should have the right dosage and the right ratios. So we have found at least 5 grams of arginine and at least 2 grams of citrulline per serving is the right way to go. That's the right dosage. That's a pretty hefty dosage. But again, that 2-to-1 ratio is important. Why? To create that 24-hour effect. So you take half of that dosage at one time of the day, early in the day, 12 hours later, you take the rest of the dosage, and then you have a sustained 24-hour release. You make nitric oxide even while you restore during your sleep. Then also it'd be good to have nitrates, right? So again, beets, arugula, all those other things that are high in nitrates would be a good adjunct. As we learned from the slide with the rabbits and the plaque regression, we saw the importance of antioxidants. So vitamin C, D3, vitamin E, pomegranate, camu berry, very high in vitamin C, grape seed, and grape skin extract. So you have botanical as well as just straight vitamin antioxidants are very effective. And we can throw in there vitamin K2 because vitamin K2 also helps for getting plaque along with the vitamin D3, getting the calcification out of things like your arteries and into areas like your bones where it should be. The other thing is proper pH. You want a good pH in your mouth. You want a good pH in your gut systemically. This is important for nitric oxide production. You also want to keep that endothelium nice and healthy. And there's good botanicals that can help with that, like hawthorn berry, green coffee bean, horse chestnut, Indian gooseberry. So hawthorn is very good for the heart. That horse chestnut seems to be more helpful for the extremities and the lower extremities, like the legs and so on. And then if you're going to take all these things that are very expensive and in high doses, you want to make sure you absorb it. How can you do that? Well, there is a complex that's called estrogen, and it's a play on astragalus and ginseng. And it's been shown to create a situation where you absorb 60% more of the nutrients that you take as compared to without it. So we felt it's very expensive, but it's worth putting into a supplement. So that gets us to the Bionox line. As mentioned, we are all about nitric oxide. So our flagship product, the one that we've had the most experience with, the one that we launched in 2013, hundreds and hundreds of reviews, both by ones that we get and also the many practitioners that we support and use this in their practice. But it is has the arginine citrulline combination in the dosages that we suggested earlier. We also use a form of arginine called arginine AKG, or alpha ketoglutarate. This helps again for absorption. It's better absorbed than your elemental arginine and your hydrochloride, and it has been shown because of that there's less digestive upset for those that may have a sensitivity to arginine. We get that very rarely as compared to when I use the elemental and the hydrochloride. It comes in 2 different flavors, berry as well as citrus. So besides the L-arginine and citrulline in our nitric oxide support blend, we added beet for its nitrate benefits, pomegranate, and watermelon. Watermelon is high in citrulline. And then we want to balance or benefit the endothelium. So we put the hawthornberry, horse chestnut, green coffee bean, and the Indian gooseberry in there, the grapeseed and grape skin extract, the camu, very good whole food source of vitamin C. We got the minerals in there for the pH benefit and the estrogen in there for the absorption benefits. So it's a complete complex arginine citrulline pathway based product that opens up the nitrate pathway with the beets that are in it. But the other products we're going to talk about don't just open up the nitrate pathway, they really sort of kick the door down, as it were. And that's our NOx3 beets. It's a lozenge that is a very has a very high amount of nitrates. It took me 9 years to find a consistent beet powder that was high in nitrates consistently that I could really get behind. Most of them had little, if any, nitrates, and some, just didn't meet the bar that we needed to sustainably create a therapeutic nitric oxide production. So depending on where the person is, our products are 100 milligrams of nitrates per serving. So like with the NOx3 beets, you put that in your mouth and let it dissolve. It's got the 100 milligrams of nitrates. It's got fermented beet powder in it. It's got xylitol as well to help with the oral microbiome. And so it's got what it needs in there to create and finish that cycle to be able to make sure that the nitric oxide is produced. They taste great. Even some people that don't like beets really enjoy our NOx3 beets. It has like a tart cherry type of flavor. The NOx3 greens is a powder. It's 26 different superfoods, but the main component is a high test nitrate value arugula extract. And so you're able to get 100 milligrams of nitrates from our greens as well. So 100 milligrams is the minimum for people that need more, 200 to 300 consumed at a time could be beneficial if they're really trying to make some nice changes in their health. They got some chronic issues. But the two together, what I do is I just take a big scoop of the NOx3 greens in the morning, drink that, then I chase it with the NOx3 beets. They both taste very good. And then the other product is our Chelanox product. And chelating metals has become most important as we are bombarded by metals daily. And we're going to talk about how it relates to the nitric oxide pathway in a second. But it's a very up-to-date. I used a ton of chelation. I used to outsource it for IV treatment, and I used to use oral chelating agents. And EDTA is very important. Chlorella, modified citrus pectin, cilantro leaf, shilajit, and zeolites. All these have an affinity for mercury, lead, cadmium, all these toxic metals, and they help to get them out of your cells so that your body can release them. And then we added support for the liver and kidneys with N-acetylcysteine, lipoic acid, uva ursi, stinging nettle, and milk thistle. So all those things, as your body then is pulling the metals, we open up the exit strategies. We open up those filters to help the body to then release these metals. And this has become very much a favorite product by our practitioners, by the general public for what it can do. So those are our main products that we have. Now, when it comes to lead nitric oxide and chelating, this is a book by Dr. Gary Gordon. He is the forefather of chelation therapy. He has tracked millions of chelation therapy sessions with thousands and thousands of patients. You ask any doctor that does IV chelation, they know who Dr. Gary Gordon is. Well, he's very much an advocate of oral chelation as well. So what is the correlation between lead and nitric oxide? Well, this is what he goes on to say. He says the mechanism by which EDTA affects nitric oxide levels has to do with the levels of lead that accumulate in all our tissues. And everyone today is toxic with lead. If you look at the periodic table of elements, you will see that the atomic structure of lead and zinc are directly related to each other. As we raise the levels of lead, we're actually plugging lead into key enzyme functions in our body that normally zinc would have fulfilled. Some of these enzymes are called nitric oxide synthesis. These are the key enzymes that are responsible for this job of attempting to help our body keep a healthy balance of blood flow by making nitric oxide out of the arginine and related amino acids that we get in our diet. So the bottom line is, to create nitric oxide, as we saw earlier, you got to create that nitric oxide synthase. But if lead jams up those receptors, zinc cannot get in to finish the job. And so you could take all the arginine that you wanted, but you're not going to create a conversion if there's lead jamming up those receptors. So that's where products such as these can be very helpful in reducing the lead burden so that the zinc can get in there and you can produce the nitric oxide that's necessary. So very interesting. And this is something that I just learned about recently. He and I always thought that these chelating agents help to get rid of calcium out of the arteries. But he was finding that even though people's blood pressure would respond, the erectile dysfunction would get better, they get circulation in areas and it was saving people's lives, it wasn't really getting rid of the calcium like he thought. So he changed what he learned as far as how it worked, and it all has to do and goes back to nitric oxide. Now, these are some things I mentioned pulse wave in the outset, and how I've done some training on these, and so I've done hundreds and hundreds and hundreds of these types of pulse wave stress tests. And the little gadget that we use now is called the Smart Pulse. When I first got involved in 2005, all that was available was these high dollar medical devices. They were $7,000 and up. And now for $500, you can get all the same data with these little smart pulses. So they do two different tests. They do a stress analysis, which is based off of heart rate variability algorithms, and it shows you your parasympathetic versus sympathetic nervous system. It shows you if your stress is more emotional compared to physical. It shows your stress resilience, which can be a good indicator of adrenal function. So that's great information. And then on the other side, simultaneously, it does a plethysmography test, which is also called digital pulse wave. And so when you put this little thing on your finger, it is picking up changes in your blood flow based on constriction, potential blockages, congestion, stiffness. And so there's 7 different possible types based on these pulse wave readings. 1 is the best case scenario, 7 is the worst case scenario. And the cool thing about this, and why I was really excited about it back in 2005, is you have a way to see if somebody's regimen is working. So what we would do is we would screen people. If they weren't happy with the type that they were getting, then we would outlay a program to restore nitric oxide levels with nutrition. We would rescreen in 90 days, and 90% of the time, they would test better if they followed the program. So I love that. It's an objective way to be able to see if the regimen is working. This is a little test that I did on myself after I'd taken the M3 as well as the NOx3 greens. I said, well, just for kicks and giggles, let me see where I'm at. And so 2 hours later, you can see on the left, my large artery circulation, peripheral elasticity, my waveform, and then on the right came out as a type 1. So that's excellent flexibility and blood flow. Now, the other way that you can do some non-invasive screening is with the MyFit strip. We created an initiative called the Spit, Eat, Repeat program, and it's based on these strips. So what you do, and actually 2 of these strips come in every box of our NOx3 beets, as well as every canister of our NOx3 greens. So you can see that it's actually has what it needs in there to make a change. So what we encourage people to do is to do a saliva test prior to taking the beets or the greens, see where they're at. Then there's a way to check it right in a little card that we put in there. And then you consume the beets or you consume the greens. And then 2 hours later, you check your results, you repeat it, and you will see a change in those strips. So it's a great way for people to visually see that our products have in there what they need to have in there. This is actually a little test I did with the leading top 10 leading beet products out there that make claims for nitric oxide boosting. So we had capsules, we have chews, we have powders, but as you can see consistently that 60 to 70% after we tested in 2 hours made very little change in the strip. So again, it doesn't mean it's bad, but what it does mean is that it doesn't have those nitrates in there that you really want for nitric oxide conversion. So with the NOx3 beets, though, consistently, this is what we see, those type of robust changes in the strips after 2 hours. Then we did the same thing with the greens. I went and got the top 10 best-selling greens products out there, powders. And again, if they have spinach and other greens in it, they should be rich in nitrates. Well, we had a pretty similar outcome. About 60 to 70% of them made very little or no change in the strip. And the strip, you notice, has 2 pads. One is an indicator of the oral microbiome, and the second pad is an indication of basically your serum nitrate levels. So obviously those should go up as you test after consuming these products. Well, what about the greens? Again, a nice robust change in the greens from consuming it 2 hours prior to and retesting. Now, tests, though, are not necessary. As we learned earlier, if you're 40 or over, you're in need of nitric oxide. Cardiovascular issues, lipid challenges, cholesterol, triglycerides, blood sugar, immune system, eye problems, energy, sleep. If you're looking to reduce medications, sexual dysfunction, brain issues, athletic performance, and inflammation, those are all things that tell you that you really need to be doing something about your nitric oxide. We're going to take just a second and see if we can listen to just a few of what some people are saying, a little bit of what they're saying.
Hi, my name is Eric. I've been taking M3 for about 6 months now. It was recommended to me by a former professional athlete. I love it. It gives me energy and it also improves my heart health. I recommend it to all my colleagues and will continue to do so. Thank you and have a wonderful day.
Hi, my name is Janine Willie and I own Terramar Wellness Center here in Carrollton, Georgia, and I take Bionox. It's probably backwards since I'm doing a selfie. I've been taking it for about 6 months and I love it and it's wonderful. So the main thing that it does for me is it helps me put oxygen in my body. I take shallow breaths, I guess, like all of us do, or most of us do, and I don't get enough oxygen throughout the day. So I'm working on my heart health and it helps my body maintain the oxygen levels that I need. So it's a great product. I recommend it to all of my clients and try it. You'll really like it. It's good for you and it's good for everybody. So have a great day and thanks. Bye.
Hi, my name is Karen Barnado. I wanted to talk to you just a little bit about some of the Bionox products, or really mainly M3. I've been using it for quite some time now. I love the citrus flavor. I feel like that I can work out better, work out longer. I don't get as tired during the day. And overall, I just feel better. And yeah, that's it. I love it.
Hi, my name is Gerald Singleton, and I wanted to recommend Bionox M3 with K2 in it. It's dramatically reduced my blood pressure numbers just by taking this twice a day, following the instructions. Better eating, better living. Bionox.
So we appreciate those. And again, we've gathered hundreds of beneficial reviews over the past few years with the M3. You know, we've just got a long, people stay on it. They continue to buy it because of how well it makes them feel. Now, this year we were privileged enough to team up with a guy that I've respected in the golf world for years. And it's pretty cool to think that I'm now working with him, kind of besides a nitric oxide enthusiast, I'm sort of a golf enthusiast as well. But this guy, back in the day, 2002 to 2006, roughly, he was a force to be reckoned with on the tour. Gave Tiger a run for the money at the British Open as well as the Masters. Been on a couple of Ryder Cup teams, but he's really into health. And so this is a good match for him as well to bring him on board. And so Chris DeMarco, he's powered by Bionox. He's 50, fierce, and fit, and just a very good person that we can promote, and I look forward to having a long-term relationship with him. Now, you can find out more information and keep up with what's going on by joining our Facebook, Twitter, and Instagram pages. And please check out our YouTube channel. We got a ton of great information, including interviews I do with Dr. Nathan Bryan that we talked about earlier, as well as Dr. Sean Green, the inventor of the MyFit strip. So I encourage you to tap into what we've done. Really appreciate your attention today. I hope that you are now more of a nitric oxide enthusiast as I am. Visit our website, bionoxusa.com. Please reach out to me if you have any questions about any of the information or our products at Dr. J, D-R-J-A-Y, at bionoxusa.com. I thank you so much for your attention today.